Let's talk about something that can be kind of scary, finding a strange, new lump under your skin. You're not alone if that makes your heart skip a beat. So in this explainer, we're going to demystify what these common lumps are all about and hopefully replace some of that worry with solid information. So just imagine for a second, you're going about your day and suddenly you feel it, an unfamiliar little bump that wasn't there before. What's the very first thought that pops into your head? Yeah, for most of us, it's a jolt of concern, and you know what? That is a completely normal reaction. That feeling of discovering something unexpected on your own body can be really unsettling, and it almost always leads to one big question. Is this serious? That's really the heart of it, isn't it? It's a totally valid fear, and today we're going to tackle it head-on by looking at the most common cause of these lumps. Well, it turns out the most common culprit behind these lumps is something called a lipoma. So let's meet this thing and figure out what it's all about. Okay, so what is a lipoma? Well, it's a slow-growing, benign tumor made up of fat cells. And I really want to zero in on that word benign. It means it's not cancerous. It's basically just a harmless little pocket of fat cells that have decided to hang out together right under your skin. And this is probably the most important thing you're going to hear today, and it comes straight from the medical literature. Lipomas have no malignant potential. Seriously, let that sink in for a second. It means a lipoma is not cancer, and it's not going to become cancer. That is a huge, huge relief. You know, you might feel like you're the only one, but they are incredibly common. About 1% of the general population has a lipoma. I mean, think about that. That's 1 out of every 100 people. So yeah, if you've got one, you are definitely not alone. So what does one feel like? Well, a typical lipoma is kind of soft and doughy. You can press into it. One of the biggest clues is that it's mobile. You can actually move it around a little bit under your skin. It's not stuck in one spot. They're usually right on the surface, they don't hurt, and they're typically smaller than 5 centimeters. So maybe the size of a large grape or a small plum. All right, so knowing what a lipoma usually feels like is super reassuring. But what's even more important is knowing when you should call a doctor. And that's what we're talking about next, because this is really the critical part. So why is it so important to get certain lumps checked out? Well, the main reason is to distinguish a harmless lipoma from something that is incredibly rare but serious, a liposarcoma. This is a malignant tumor, and telling the two apart, that's the whole ballgame. Okay, so let's break down this comparison because it's really helpful. You can see here lipomas are usually soft and squishy, right near the surface, and they move around. Liposarcomas, on the other hand, tend to be firmer, deeper in the tissue, and they might feel totally fixed in place. Now, I have to be super clear about this. This is not for self-diagnosis. These are just general clues. Only a doctor can tell you for sure what's going on. So let's make this really simple. When do you absolutely need to see a doctor? Well, if you have a lump that's bigger than 5 centimeters, if it feels deep, hard, and totally stuck, if it seems to be growing fast or changing, or if it starts to hurt, those are your signals. It's time to make that call and get a professional opinion. All right, so let's say you do decide to see a doctor. What's that going to look like? Let's walk through the whole process step by step so it feels a lot less mysterious and hopefully a lot less scary. The good news is the diagnostic process is usually really straightforward. It pretty much always starts with a simple physical exam. Your doctor will just feel the lump, check its size, see if it moves. If they need a better look, they might order an imaging scan, like an MRI or a CT scan, to see exactly what's going on inside. And honestly, it's pretty rare, but if there's still any question, they might do a biopsy to get a definitive answer. And these scans, like the MRI you're looking at here, they are so useful. They let doctors see right inside the lump. They can tell if it's just fat and if it's nicely contained in its own little capsule, which is a classic sign of a simple, harmless lipoma. And here's another really important point. Once it's confirmed that you have a lipoma, you don't necessarily have to do anything about it. I mean, since they are benign, getting one removed is usually your choice. It's typically only done if it's bothering you, maybe pressing on a nerve, or if you just don't like the way it looks. Now, if you do decide to get it treated, you've got a few options. The most common is surgical excision. That's where they remove the whole thing, the fat, the capsule, everything. It's the most effective way to make sure it doesn't come back. Then there's liposuction, where they just suction out the fat. This leaves a smaller scar, but there's a better chance the lipoma could grow back. And for really small ones, there are injections that can dissolve the fat. But with that method, yeah, it's almost guaranteed to come back eventually.
Okay, that was a lot of information, I know. So let's just pause and recap the most important things to walk away with. What are the key takeaways here?
Number one, and if you remember nothing else, remember this. Lipomas are super common and they are benign. They are not cancer. Full stop.
Takeaway number 2. You now know what to look for. You understand the key differences, things like size, feel, and how fast it's growing, that can help you tell the difference between a typical lipoma and something that needs a doctor's attention. And finally, takeaway number 3. The process of getting a diagnosis is not some big scary thing. It's usually very simple. And most of the time, the final recommendation is just to leave it alone, unless it's actually causing you a problem. Look, we've gone through all this to give you knowledge and take away some of the fear, but it's not a replacement for a doctor. So the ultimate takeaway is this. If you find a new lump or one that's changing, what's the right next step? It's always talking to your doctor. That's the safest and smartest thing you can do.